So your ankle is busted. It's not broken, but it hurts as dickens. Hi, I'm Dr. D, and this is another episode of your travel medicine tips and tricks. So keep watching because you will learn today. Today we will be discussing specifically ankle sprain. However, the general principles for using ice and heat discussed in this video can be applied to most sprain injuries. We will cover things that will not only help you feel better right away, but also help you get back on your feet ASAP. Pretty much everybody knows that you should ice your sprained ankle, but how to do it more efficiently so that you get the most out of it? How do you combine several strategies together to get the best synergistic result? When should you not apply ice and apply heat instead? In this video, we will cover all of these and several other useful tips for a quick recovery. Before going any further, I will address the continuous debate on icing or not icing. While icing has been the mainstay of treatment for acute ankle sprains since 70s, in the past few years, voices have been emerging noting that icing may not be the greatest thing for acutely sprained ankle. The thought behind that is that it may actually slow down the healing process. When researchers tried to answer this question, they came to the conclusion that there is not enough evidence to suggest that icing is beneficial. However, they also could not come up with any strong evidence noting that icing is harmful. So where does that leave us? It all comes down to using some common sense and personal opinion. If icing feels good to you, try to use the suggestions in this video and see how you feel. If icing doesn't feel good, don't use it. From my personal experience, I can say that I have not seen any significant problems when patients use ice for the first 24 or even 48 hours. I personally lean towards the shorter time frame, but it always depends on the individual patient's presentation. More significant swelling may need the 48 hours, while very mild sprains may not need any or only 24 hours. Bottom line is that there is no hard evidence that icing the sprained ankle for the first 24 to 48 hours will cause harm. In my personal experience, icing has been actually helpful. I have seen the biggest impact on successful rehabilitation and recovery from acute ankle sprain from the rehabilitation process that takes place after the initial 24 hours, rather than what happens in the first 24 hours. So let's not get too wrapped up with tiny details and ignore the elephant in the room. Additionally, this video is meant for people who are on the road, traveling, and need something that will give them quick relief. Why do we put ice on a sprained ankle? Duh, it feels good. Well, that's for sure, but that's actually not it. Putting ice pack on your sprained and swollen ankle is actually a very important component of the healing process. If we want to be more medically correct, we would say that the ice helps to cool down the acutely inflamed tissue around the ankle, which helps to slow down the cellular metabolism in the injured area. Hey doc, that's a mouthful. What do you mean by cellular metabolism? To put it simply, let's say that it cools down the fire in your sprained ankle. How about that? The cooling process is important and it should be started ASAP, as soon as you can after you sprain your ankle. Why? Because it decreases the extent of the damage to the surrounding tissue. It will prevent the further spread of inflammation and in turn, it will decrease the pain and swelling of the ankle. So what's the best way to ice my ankle, you ask? Well, dumping your foot into a bucket of ice would sure work, but that's not the best you can do. You are here because you want to do better than that. So the better way is to combine 4 principles together: icing along with compression, elevation, and resting your ankle. You definitely cannot do that with your foot in a bucket of ice. So let's see how we will go for that. The first thing you need is a crushed ice and a plastic bag. You will also need an ice wrap and a pillow or something else to put your foot on. So step 1. Place the ice into the plastic bag. And here is the first important tip. Squeeze out all the air from the plastic bag, since the presence of the air inside the plastic bag will make the ice melt faster. It also makes it harder to accommodate the ice bag around your ankle. Now we are ready to put the ice pack on a swollen and painful ankle. You may hear people saying that ice packs should not be placed directly on a skin since it can cause tissue damage called frostbite. Well, that's actually not so true if you are a healthy person without any medical condition that affects your blood circulation. Yep, I already hear some of you saying, "Man, you crazy." Well, hear me out here. First of all, we are not talking about the commercial ice packs that you keep in your freezer and put directly on a skin. We are talking strictly about crushed ice placed into a plastic bag. Second, the temperature of ice is around 32 Fahrenheit or 0 degrees Celsius. Once you remove the ice from the freezer, it starts to melt. Since the human tissue begins to freeze when it reaches a temperature of 28 Fahrenheit or minus 2 degrees Celsius, it is pretty hard to freeze your foot if you follow the recommendation of applying the ice pack for no more than 10 minutes. So yes, we do not recommend placing a cloth between your skin and the ice bag. Why? Well, simply because it will diminish the full effect of the ice pack. Now here is the important part that many people miss. Most keep their ankle wrapped up with the ice wrap and take it off when they go to ice the ankle. Or even worse, try to put the ice pack over the ice bandage. But since you are watching this video, you will not do any of that. You will secure the ice pack at the desired area using ice wrap. Using ice wrap will eliminate the air between the ice pack and the skin, which will help to keep the lower temperature of the skin for a longer period. So this is how you do it. Place the ice pack directly on your ankle and wrap it tightly, but not too tight so that it's painful. It's very simple to do, just follow these steps. Start with a wrap from the outside of the foot to help drain the swelling away from the foot. Establish the base and then start with the figure 8 wrapping. Rewind the video if you missed it, but it's fairly straightforward. Some recommend doing a little pull when you go from the bottom up to evert the ankle. Eversion means moving it outward, since you injured the ankle by inverting it or twisting it inwards. This little pull may help to return the ankle to its normal position, so try it. Now that you have nicely wrapped the ice onto your ankle, you have accomplished two things at the same time. You apply the ice along with compression. The last thing to do is to lay down and lift your foot 6 to 8 inches above your heart level to allow for the swelling to drain. So now you will ask, "So Doc, how long can I leave the ice pack on?" Well, ideally you can keep the ice pack on for about 10 minutes, but not longer than that. You can apply the ice pack on for every 2 to 3 hours during the day for a maximum of 4 times a day. So let's see what we did. We have successfully accomplished the RICE protocol, which is the mainstay treatment for acutely sprained ankle. It includes the rest, ice, compression, and elevation. Now before we talk about how long should you be applying the ice pack on the acutely sprained ankle and when you should not be applying ice to your ankle at all, let's talk a bit about the compression, elevation, and resting, so that we are all on the same page as to the understanding why we want to use all 4 principles for the best recovery and how do they actually contribute to our recovery. Let's start with rest. What do we mean by rest? Do we mean that you should tell your boss, "Hey man, I sprained my ankle and I need to stay in bed for the next couple of weeks to rest it"? Well, you try that and let me know how it went. Actually, what we mean by resting is not overdoing things. Rest is important to allow the proper healing to take place. Since most ankle injuries involve tear of the supportive ligaments, to a greater or lesser extent, any excessive movement during this acute inflammatory stage is contraindicated. However, it is important to start moving the injured ankle as soon as it is ready and able. Immobilization for extended periods will lead to more stiffness and prolong the recovery process. In other words, motion is the lotion. So yep, no bed rest man, sorry. But care must be taken to avoid excessive activity that is beyond what the tissue is capable of handling, since this will only lead to more damage, inflammation, and swelling. So what about compression? Well, we already touched on that earlier. Compression helps to support the injured tissue and consolidates the injury by moving fluids in the swollen ankle away from the injured tissue. We can easily accomplish that by applying the elastic ACE wrap, as we showed earlier. When you wrap your ankle, make sure that you do not wrap it too tightly, because that can restrict blood circulation to your foot. You will start feeling a tingling sensation and numbness in your toes if you do that. If it happens, unwrap the ankle and redo it. In general, it is recommended to wrap the ankle only during the day and leave it free and elevated at night. So how about elevation? The elevation is important in the initial phases of recovery, when there is swelling, to help with decreasing the pressure in the tissue and draining away the fluid from the swelling. So just by elevating your foot, you will get some pain relief, because the fluid that accumulates in the area of swelling is what causes most of the pain. By allowing the fluid to drain, lots of the pressure can be alleviated. It is recommended that the ankle is elevated 6 to 8 inches above the level of the heart. This helps to move the fluid through the lymphatic system. Doing it during the day might be challenging for some individuals, but everybody can do it at night when sleeping by placing a pillow under their knee and ankle. But you will also do it while you are icing your ankle to take advantage of every minute that you can spare to treat your ankle. So now let's go back to the question, how long should you be applying the ice pack or the acutely sprained ankle? In general, the acute inflammatory stage lasts about 3 to 4 days, so we do not recommend icing the sprained ankle for any longer than 48 hours. Applying ice for a longer period of time will actually slow down your recovery process. In most cases, 24 hours is usually sufficient. So let's talk about when you should not put ice on your ankle. Way too many times I see patients coming to our emergency room even a couple of weeks after their initial injury still putting ice on their ankle. That is absolutely not necessary unless you re-injured your ankle and it's swell again and it's hard to touch. Otherwise, there is no room for icing your ankle past the initial 48 to 72 hours. So now let's switch gears and let's talk about the heat. After the acute inflammatory stage, which generally lasts about 3 to 4 days, the recovery stage starts to set in. This is when you want to start getting things to move. Heat is a great therapy for most musculoskeletal injuries, and it is considered a universal treatment for most pain conditions. Of course, except for those that are fresh new injuries. Heat has been used for the treatment of strains, sprains, muscle spasms, and contusions. In sports medicine, heat has been used extensively because it helps to increase cellular metabolism and fluid circulation. In other words, heat improves circulation, which helps to remove the waste products and edema that are left over after the acute inflammatory process. Heat is also a great modality for rehabilitation because it increases the flexibility of the collagen fibers in the tissue. But what is collagen, doc? Well, to put it simply, Collagen fibers are structural elements found in our tissue that help to transmit forces and limit the deformation of various tissues in the body. So application of heat to the tissue is great, especially before stretching and exercising tight and shortened muscles, because it makes them more flexible and less painful during the stretch or exercise. So what is the best way to apply heat? Heat can be applied in a form of dry heat or moist heat. Heating lamps used by acupuncturists and some physical therapists deliver dry heat. This can be beneficial when acute inflammation has resolved but swelling remains. Moist heat, however, is more effective and provides quick pain relief and faster increase in tissue temperature. The simplest way to apply heat to your ankle is by soaking it for 15 to 20 minutes in a bucket of water that is as warm as you can comfortably tolerate without burning yourself. Adding Epsom salt is also beneficial. It is hard to say how much more adding Epsom salt to the warm bath adds to the overall effect, but since it is not known to cause any major adverse reaction and it's quite inexpensive, why not? Doing gentle ranges of motion while soaking your foot in the warm water is a great way to start further rehabilitating your ankle. So what about topical ointments? After the initial 72 hours, when the acute swelling and inflammation have subsided and you started to do the warm bath soaks, you can also add application of topical liniments or creams. Common example includes Tiger Balm, Bengay, Icy Hot, and so on. The main effect of these creams or ointments is in stimulating specialized receptors in your skin that will continue stimulating blood circulation in the injured area even after you stop the warm soaking. Making sure that you have a good blood circulation in the injured area is important to allow the blood to bring in new nutrients that promote the healing process and flush out all the chemicals that slow down the healing. Make sure that you do not apply the topical warming creams onto the skin for at least 30 minutes after soaking it in warm water. I highly recommend not daring this and trying to be a hero. I can almost guarantee you that you will do it only once. Yep, it could cause significant burning pain and discomfort. It is also a good idea to limit the application of the warming ointments or creams to more than 2 times a day so that you don't irritate your skin too much. Lastly, always put on a little bit of the cream on a small area of the skin to test how your body will react to the cream. Some people may react too strongly and experience a strong burning sensation. So here you have it, folks. Today we discussed how to ice your ankle more efficiently, how and when to use heat, and we also talked about topical creams that will help to speed up your recovery process. Hope it helps, and I'll see you in our next episode of our travel medicine tips and tricks.